So welcome again to Hadriel Caring monthly webinar. Again, just as introduced, my name is Olayinka Aremu. We want to make this very brief and short, and the webinar will be recorded. So for those who might not be able to join in today, and they can catch a replay actually. So I suppose what we are doing, first of all, let me give a little bit more detailed about Hadriel Caring. So Hadriel Caring is an integrated care web app that connects older adults with trusted caregivers, both nationally and internationally. So whether you're a caregiver, a family member, or healthcare professional, this session will definitely equip you with the knowledge and tools to better care for older adults. We are preparing for our official launch in Nigeria in November, so we'll share more details about that. But for today's webinar, we'll be talking about managing depression in older adults. So we're focusing on this topic. As we know, mental health is just as important as physical health, but unfortunately, depression in older adults is often misunderstood, overlooked, or left unaddressed. I'll give a specific example of my own, like this is a real example experience from my end. 3 years ago, about 4 years ago, 2019 precisely. So we lost my elder sister, and which happened to be the firstborn. I would say that particular event, drove my mom to depression. My mom is 72-year-old, and she withdrew from almost every activity, a very active, independent woman, and kind of had a toll on not just her mental health, but even her physical health. So we can see that mental health issues or depression doesn't just affect emotions, it also affects the physical health, because what happens is they neglect, that self-neglect and the things that really interest them, they stop doing it, and overall affects their physical health as well. So our goal this evening is to shine a light on this issue and provide you with the knowledge, strategies, and tools that can make a real difference in the lives of the older people and their families. Again, just to touch more on our mission in Hadriel Caring is to ensure that older adults receive personalized quality care that supports not just their physical needs, but also their emotional and social well-being. So tonight, we are joined, of course, by the program assistant of Hadriel, Ritiola Babakemidayo, that earlier, welcomed us, and she'll be moderating this session. And of course, we have our distinguished guest speaker, Dr. Grace Faronbi. And I'll just talk a little bit about her before we bring her on to take us on this journey. So it's my honor to introduce our distinguished guest speaker for today's session, Dr. Grace Oluwatoyin Faronbi. She's an internationally trained registered nurse and public health scholar with over 25 years of experience in nursing and healthcare. She holds a PhD in nursing education from the University of Witwatersrand in South Africa. I hope I'm correct about that. Where she had a research focus on identifying and reducing cardiovascular health risk among older adults, a growing global challenge with far-reaching implications for health systems. Her passion for older adults care has taken her across Nigeria, South Africa, Germany, and the United Kingdom. Over the years, she has worked in diverse healthcare settings, beginning her career at the School of Nursing and Midwifery at Wesley Guild Hospital in Elisha, and later at the Obafemi Awolowo University Teaching Hospital Complex. She went on to pursue both her first and second degrees at the Obafemi Awolowo University, with a focus on older adults and public health. Her expertise in gerontology was further deepened through the DAAD-sponsored research exchange at the German Institute of Applied Nursing in Cologne, Germany. Dr. Faronbi has authored and co-authored several research publications in reputable international journals, and she continues to contribute actively to scholarship with what most currently under peer review. So we have here with us not just a respected academic and practitioner, but also a devoted wife and mother. Ladies and gentlemen, join me again to welcome our guest speaker, Dr. Grace Oluwatoyin Faronbi.
Thank you so much. I really feel honored to be with you this evening. Thank you for so much introduction and all of that bit. Well, it's a pleasure, and I give all glory to God for the little bit I've been able to, contribute well in research and academics. And it's a great honor to be with Age Well Care Link again this evening. I really appreciate what you are doing, globally, and I really, thank you so much for reaching out, connecting nurses together and caregivers as a whole. The main goal is quite explicit and quite formidable, and you've done quite well. And I really know you're going places by God's grace. So I thank you for the honor. I feel so honored and humbled, to be here this evening. Right. Thank you so much. So we'll just go straight on, and I'll share my slide. Regarding the topic of this evening, I know it's something we all, know quite well and we're familiar with. So I'm sharing my screen. Can you see my slide, please?
Not yet. Probably it's coming up.
Not yet, ma'am.
Right. Okay. It's rolling. Yeah. Systems at times. Yeah. Right. So while that's coming up, I would just hopefully, yeah, that will be in a few minutes. I just didn't want to budge into the system. Yeah, so we're talking today about managing depression in older adults. So I know we just have a few minutes to do that, but hopefully this will come up. I don't want to take so much of my time. We'll be looking at the key things, the key concepts of depression, older adults, and then, can you sit now, please? Oh God. Yeah. Please let me know if you can see my screen.
Not yet, ma'am.
Sure. Oops. Okay, let me see. Why is it doing that? Here again. All right. Can you sit now?
Yes, ma'am, we can.
All right. Thank you. Where is it now? Not showing on my screen. Just give me a moment. You can see the screen, right?
Yes, ma'am.
Right. Because I need to also get hold of the screen now, but it's shared with you, but it's not showing on my end again. Just give me a moment, please. Text and sorry about that. I'm back. Can you see me now? The screen rather, because I had this technical glitch with the screen. Can you see it now?
Yes, ma'am, we can see your screen.
All right. Apologies. Okay, right. So it's managing depression amongst older adults, and I just don't want to waste so much time on that. So looking at the relevance of this discourse, we look at the key things to be aware of when it comes to depression and older adults. We know that the world itself is aging at an alarming proportion. When you talk of the baby boomers, we're talking of around the 1940s to to the 60s. That's when we had after the Second World War, we had the baby boomers. And when, things were a bit better after the war and people were having children and all that. So we had lots of baby boomers and the history behind it, but I can't waste much of the time on that today. But the truth now is the baby boomers are now the aged. That's why the healthy aging mantra focuses on those who, as at then, had lots of children and all that, and people were growing and thriving. So why do we need to focus on the aging population right now? Even, we moved from the development goal to sustainable development goal. And this goal is, majorly talking about health and well-being of individuals. So when we are talking of population of the aged, in the year 2000, we had just above 500 million, which is around 600 million. But steadily we kept increasing, and now we have, from in the year 2020, when we had COVID and all that, the aged were around 1 billion by statistics, and then approximately now we're moving to 1.4, and that's by the year 2030. So we're targeting to hit about 2050. 2.1 by 2.1 billion by 2050. So what am I driving at? As at the time, when we're coming to the millennia, we were talking of the year Y2K and all that. So you were talking of so many health mantras like health for all by the year 2000, moving to 2010, 2015, and, moving on and on. So this is 25 years post the millennia mantra, and we are hitting 1.4 billion in the aged population. And in another 25 years, which is 2050, we'll be talking of about 2.1 billion, which means every one of us, most of who are participants of this webinar, would be almost, if not in that age line by then. While we also need to know that the driving force for, this increase, and then, the population of aging is the falling birth rate, and the life expectancy based on new things are coming up, technology, health-wise, and people are changing well. So I had a little tweak on the topic itself, because it says managing older adults. So with depression, before we go into depression issue, we ought to understand some basics about older adults and aging. What do you think when you talk about aging? On the average, people think of people who are frail, aged, and burdensome. So we are going to look at 4 key things in this webinar in a short while, and then we'll wrap up. So we're talking about the ages concept, the physiology of aging, the vulnerability of older adults to depression, and then how we manage these older adults. So back to what I was saying the other time, when you talk about average older adults, you have this negative stereotypes about them. People talk about, frailty, weakness, burden, debilitated states. So that's what the average, I would say human, but that had been the cliche for a very long time when it comes to older adults, which should not be. When we're talking of older adults, these are treasures. These are people who have wealth of knowledge we ought to tap from. These are people who have really labored, who have, garnered experiences over time. And they deserve to live, their life to the full with dignity and respect. These are people we ought to love and who ought to be well supported. So we'll quickly run through the physiology of aging in a very short while, because I know it's a very complex issue, but we'll just bring it home and then link it to depression. So when you look at the issue of physiology of aging, it's basically talking about the gradual decline, of organ, body systems, the cells, the tissues, and everything. It's a normal process. This is not a sickness issue. This is not pathological this time around, but it's just a natural, irreversible changes that happens across board. That's about all the body systems. Everything gets, old and changes over time. And then the immunity of such individuals begin to decline. And then they don't have the strength, to cope with stress as much as agile, average young adults would. And then they become more vulnerable, to diseases, to illness, and then, talk of delayed progress of healing. And in all, this affects their quality of life because, there's a decline in the overall well-being. So we'll now look at why older adults are predisposed to depression, as well as the structures in place, because when we look at, of course, we have to drive it home and bring it to Africa. Are there structures, are there policies in place for older adults? Of course, we know the answer. Now back to depression, we look at the reality of depression and our, African setting. Do we really embrace depression in its real context? Do we agree with, the concept of the reality of depression? Is it viewed as something that is, not part of us, or it's not a reality? Or do adults themselves, do they bottle up this experience because they know they will be tagged or, labeled for what they are not? So we'll look at depression in a short while because I quickly have to run with time. It says it's a mood, experts, putting this together as a mood disorder that affects, individuals, and it is characterized by some major features. And those features are, based on the type of depression, because they are also in types. So we'll look at the major depressive disorder, which is the commonest. So it comes with clinical features of persistent feeling of sadness, loss of interest in activities, withdrawn activities. But the key factor there that I try to embolden says for 2 weeks, because if it just happened like a one-off thing, or just based on the stress of life of one day, you don't call that depression. That doesn't mean that that person is depressed. So it has to be sustained or persistent for at least 2 weeks. Now, the other chronic type, which is the persistent depressive disorder, that lingers on but comes in softly for over 2 years. So there's an accumulation, a bottling up of so many things ongoing for that period. And then some other types, which I wouldn't be mentioning today, talking about bipolar disorders. That's some bit of mood swing and a bit of mental health issues there. We have some who are seasonal affective disorders. That's when you talk of, some who have problems when it comes to some certain period of the year. And then some are medically induced, by some drugs and medications they take. And then those that are not related to older adults, we wouldn't be mentioning them, like the postpartum depression and premenstrual dysphoric disorder and other bits. So those are not our focus for today. So what are the predisposing factors to depression? Because we need to know that. The examples we gave, I mean, when we're talking about physiology of aging, we said all the body system tends to change and decline in function. And then you see that older adults are mostly susceptible to issues of chronic illnesses like stroke, heart disease, and musculoskeletal issues. Basically, they complain of arthritis, so many, pains and aches here and there. And then we have issues of cognitive decline when, based on, the mental capacity that is declining gradually. And then they come up with issues of Alzheimer's, dementia, and so many other things. Unfortunately, this could be mistaken for aging process, especially in Africa. So, oh, that grandma is here again. I mean, she just say things out of context. Well, in reality, rather, something is going on. And then we have medications, just as I said earlier, as well as other underlying medical issues like maybe hormonal imbalance, menopause, and all that. So because we do have a long list of them, I'll run through them because our focus actually is on managing them. Then the fear of death or dying, as you age, people are worried, am I going to die? What happens to me after life and all of that? Then caring for, and being responsible for spouses, maybe those who had spouses who had, long-term illness and all that, chronic illness. So all of this put together becomes, burden on individuals who care for them, even as, spouses. And then loss of spouse, family members, and close friends. The CEO was mentioning her mom. So things of such are common everywhere. People lost loved ones and all that. So all this bottled together to have effect on individuals. Then there's loneliness and isolation that comes with, maybe lifestyle changes. People who go to work usually mix with people and all that, they suddenly become retired and they are isolated. Some, come as a result of, the empty nest syndrome, when all kids are grown up, they are all over the places globally, and the parents are left alone, possibly even with maybe just one of them, if the one of the spouses maybe died earlier. So it could be grandma alone or grandpa alone. So all this accumulates and leads to depression. Then we've got issues of socioeconomic factors, just as I've said, and it could be as a result of poverty. We know what obtains, in our climb. We know what happens, when people lost job and maybe as a result of retirement, which is even a natural thing that happens. And then those who are retrenched, some are retrenched maybe early for some reasons, and then some even have failed ventures and businesses. All of this come together to become a problem. We have some who have, other health problems, feeling unwell, mental health problems, unable to access, healthcare and facilities that would have early diagnosis for them. Then we have another key thing, especially for care workers, that's underdiagnosis. when depression is being misinterpreted or overlooked, just as I said earlier, you just see that, oh, don't mind him, he just talks out of context, whereas there's something phenomenal or fundamental wrong at that instance, but we're not picking it up as early as possible. Then another key thing about us, in Africa, we spiritualize things, which are very good. We are people of faith, which is very nice. But unfortunately, when people start exhibiting some symptoms that we ought to pick up, we start, praying and all that, which is of course good, but we're not taking action or backing it up with action that is needed to have, the safe space and then the healing process as it ought to be. Then abuse it's a long, context on its own. We have various types of abuse: physical, verbal, emotional, sexual, financial, and all of that. All this come together, back to the older adults, and then they develop depression. So what are the basic signs and symptoms we see? We see things like emotional symptoms, persistent sadness, loss of interest. Physical symptoms also come, like we have said, loss of appetite, change in appetite, losing sleep. They become fatigued, complain of so many illnesses and pain that, the list is just endless, but I just don't want to focus on that. Now we quickly run through managing depression. I love this word by Martin Luther that says, you cannot keep birds from flying over your head, but you can keep them from building a nest over your head. That's the major thing about depression. Because if you look at the outlines of things we've seen so far, there are some that you just can't avoid. You can't afford to, have them one point or the other. But what are the dispositions of individuals to that? That is what saves individuals from depression. Now, we'll go to things to note, which are very paramount with managing depression. If you quickly do a role reversal, that's what helps you. As a caregiver, always do a role reversal and think about it. How would you love to be treated at old age? It helps you a lot. So you don't just handle them like one of those clients or one of those patients. How would you love to be handled at your old age? It will guide you on how to, relate with either clients or family members. Then also remember that every individual has their own challenge, either though they are unique or you're in their own, being and as, individuals, but they are faced with their own challenges as well. And it could be different. So those say, oh, you are just lazy. Grandpa A doesn't do like Grandpa B. Grandma A is always, agile. She's up and doing. Why are you this and that? No. Every individual have their own challenges and they face it differently. So we need to support them all through this process. Then that leads to the third one that says their generic line of care, supporting, caring, loving, TLC, and all that goes for every individual. But we should always remember person specifics when it comes to managing depression and individuals involved. So now we need to do this together. The first thing to do when it comes to depression is to acknowledge there's a problem. If you don't acknowledge there's a problem, there's no way you're going to solve it. When something is fundamentally wrong, don't just gloss over it and say, oh, well, I think it's nothing to worry about. We need to seek way out of such, problems or challenge. Then we need to note these things, either they come in softly or they come in a gradual form. When it's becoming repetitive, then there are red flags to be, noted and worked upon. Then we need a lot of patience. There's one of the things I usually say: older adults are once an adult and twice a baby. When they were growing up, they were a baby. At some point, they were adults, but they become babies again, dying or aging. We should say not dying, aging. So we should take care of them with patience. It requires a lot of patience and adequate support because we need to know what really identified or what triggers the depression they are sliding into, and then know how to work with them, work with the family members, work with the individuals themselves, and then as care providers. Then we need to identify the strengths and weaknesses of every individual. Just as I said, you don't compare people and say, oh, you need to be like ABC. Every individual is unique. Then on the basis of individuals themselves, I mean the older adults now, they need to, most times I know when we're, in schools and we learn about distress atrophy, this happens when individuals, whatever you don't use, you tend to lose. So oftentimes in advanced country, these older adults are, because they are prone to dementia and all of that bit, they tend to engage them actively. Unfortunately, this is missing back home, in our climate when people are just there. Once I'm retired, let me just enjoy life. That redundancy, it's like a time bomb. So we need to engage them. There are things that they could, they love to do and all of that would help them to keep functioning well. They could pick up new vocation. I knew there was one of this seminar or thing the CEO was talking about, engaging and the passion of individuals. And even after retirement, it was one of my post graduate studies, post-retirement engagement of older adults. They need to be engaged, otherwise the quality of life drops fast and drastically. Then social engagement, like, religious activities, volunteering and all that, is also part of, learning or giving back to the society. And finally, where I will base my point and my focus is nutrition. We know nutrition is quite vital. We can't overemphasize that. It's very important and all of that. So in aging, you don't just say, oh, because the individual will eventually age, let them just eat what they like. No. Nutrition helps, older adults, it boosts their immune system. It also slows down the progression of health, decline. So you don't just eat anything. It is just starchy food today, this tomorrow, just eat what you like. I mean, what do they have? Everything is almost dying. Let's just don't eat what they no. I've worked with lots of older adults here, 80s, 90s, who still drive, who still gym, do lots of things. Why? Because they maintain good health. And I've seen individuals 60 and below who are just not in a good shape. So nutrition is quite important. However, we should look at the catch to this, because older adults have this way of being fixated and lost interest. I will cite an example of my grandma shortly. When you ask her when she was alive, what would you like to take? She will tell you anything, and you just go get her anything if you dare. The next thing she will ask you, don't you have this? Is there not that? And then you now wonder, but I asked you a short while, you're asking me anything. She said, well, I don't want that, I want this. And you're in problem, that you have to go for it. So it tells us that we have to pay attention to what our older adults are taking. And then this was one of a sample of my postgraduate study when I was doing my running my PhD program. It talks about the sample, because it came up as a result of a focus group discussion and all of that. In the end, it was so blessed. It was a great blessing to the older adults, because I had to do a pre and post intervention, and it was just marvelous, because they tend to forget things. They have this statutory law of, well, just give me anything. Some are just not there, especially when they are depressed. So what would they do with all of this? They don't want to know. But we need to, help them, support them, and make sure they get best of this. So as caregivers and as providers, as family members, and even, as friends, we need to change the narratives around, the stereotypes of what you think about older adults and how you think their problems, or they are just, a burden to you, pain in the neck and all of that. All of that must stop, globally. It's a pushing forward now for everyone, to embrace and love the older adults, and then create a space safe for them. They should be able to confide in you, communicate with you, because they know you just love to be with them when you have time to relate with them and all of that. So we need to support them and not just say that they've come again. And then this comes with creating more awareness, being compassionate and intentional, just as I've said, because if you just let me just do my job and leave, I don't think there's much of blessing there. Even the blessing of an older adult is something for me. That's one of the catch. I just putting smile on other people's face. It goes a long way. And we said it needs a lot of patience to get into that. And there's one of the things I love to say, that if you can't heal the wound, don't add to the pain. It is very, very important. If you cannot heal the wound, because when you look at depression, it's a wound, though you don't see it physically, it's an inward thing. So if you can't heal the wound, please don't add to the pain by what you say, by what you do, by our disposition. And that's just in a short wrap up, because I know it takes a lot to talk about depression. It takes a lot to talk about, cooperating to work with them. So in conclusion, tonight, I would say managing depression in older adults requires a lot of patience. I can't overemphasize that. We need a lot of patience and compassionate approaches to, to address their unique needs and experiences. So we don't have to do it as a global thing. We don't have to do it as a generic thing. Though we have generic stance of what we do, let's do it on a individualized basis. Let's do it with the end goal of bringing individuals out of depression, not adding to the problem. And it goes a long, long way, because whatever you sow it is, you will surely reap. Thank you for your time. And I guess I have done a little justice to what I could do for. Thank you.
Thank you so much, Dr. Grace. That was so insightful. I learned a lot. I just kept jotting down a lot of things. Thank you so much. Like, you really just, opened my eye to a lot of things that I didn't even know. No, like we generalize a lot, to be very honest, when it comes to having our older ones around. Even with me, practically speaking, my grandma from my maternal side is still alive. When she comes around, we're quick to say, Mama has started again. We're quick to overlook the things that she does. So like I understand better how we should actually be very holistic to our approach to older people. And we should actually put ourselves in their shoes because one day, by God's grace, we'll also be in that position. Thank you so much, Ma, for that, for this wonderful insights. I personally learned, and I hope everybody did too. If you're just joining, welcome to our webinar. Please put your questions in the chat box. We'll take a few questions now if we have. So while we wait for people to put in their question, I'd like to ask a question personally. So like you mentioned about a major depressive disorder where the person is moody for at least 2 weeks. So I just want to ask, what are the practical steps that can be taken at that point when you notice that, oh, you're like the older adult is exceeding that 2 week step of, because they can actually be very moody sometimes. They can be very isolated a lot of times. I know that we play a role, we are around them, but when you notice these things, what are the practical steps you can take as loved ones and also as healthcare professionals? What can we actually do, ma'am?
All right. Thanks for that question. Yeah, really, because that was why we said you don't just base your judgment on a one-off experience. So, over time, 2 weeks is a long time to know something is wrong with individuals because that means there's a shift from the usual, way of life, the usual, daily activities of, daily living and all of that. So what we need to do first is to pay attention, show that you care. And most of the time, if you just do it verbally, like, how are you feeling? They'll tell you, I'm fine. That's it. They'll tell you you're fine. But I'm fine, rather. But, every individual, that's why I said they are unique in their own ways. There are things they love to do. There are things that, there are, you may be someone who loves music, someone who loves to play, the local, games and all of that, and suddenly gets withdrawn from such. You bring it to them first. You don't just come and stand on someone else and hey, someone said and say, how are you feeling today? And you expect him to say, oh,
Mhm.
it's A, B, C, D. No. So that's where the patience comes in. So
Yeah,
you need to bring yourself down to them. So that's why I said, an older adult is once an adult and twice a baby.
that's right,
You can't
baby.
stand there and the baby say, what do you need? And the baby said, it's even well, a baby might say, but if you shout down a baby, he would shut down. You know, I mean, growing toddlers
Yeah.
and all that. If you just say, shut up, and the next thing you say, come, the baby will hesitate at first. Like, do you really mean I should come? you know do you really
Mm-hmm.
want my
Mm-hmm.
attention? Do you really want me to talk? So the same thing, it's just that same way. They need a lot of attention. I know we have a lot going on and all that, because especially at work and all,
Yeah.
but we need to create that time. You might not get into the real problem or the context immediately, but when you enjoy yourself the first time, maybe you brought at least maybe you brought the music the individual loves. At first, maybe like, "Ah, I don't want it and all that." After a while, you just see the person, just nodding, and maybe after a while, you might even still leave the person just to enjoy the music for a while and then come back. That person feels like this
Mm-hmm.
person loves me, or this person wants my attention, or this person wants to listen to me. So that's why I
Yeah.
said, managing them, we have to do with their individual and the individuals themselves, their family members, because at times when if it's a caregiver, you don't know, the history of what they've been through or what they love and all of that. And if you've been to care homes and other places, there's a column where they talk about what they like, how they like it, what time they wake up, what time they like this, and what meal comes before what. So that speaks about the uniqueness of individuals. So you work with what they like. So you can't go before I mean, you can't go too long before you burst the bubble, because at some point they're always one of the things depression people do, this they build this wall around themselves, like they don't want you to come near. So, but after endearing yourself to them, today just a smile, tomorrow just a talk, the next you are sitting by themselves, it doesn't take long. So that's why you don't really have to. I'm sure even in fact by the first week, something is wrong. So before it gets to the end of the second week, when you are concluding that this is definitely depression, you are close to finding solutions to the problem. So that's what I would say in a nutshell about addressing such. Thank you.
Thank you so much, Ma. Thank you. That was also very, very insightful. Thank you for this vast of knowledge on managing depression among adults, among older adults. We're so grateful for your insight. We do not have any other questions right now from the chat box. I can't see any questions from anybody, so I would.
Maybe I can add a question.
Okay, ma, please go
Maybe I
ahead.
can add a question. Dr. Grace, thank you so much for that wonderful presentation. I think for me to be more of how to identify or recognize depression in other people. I think you might have touched about on it, but maybe more practical way of identifying or recognizing that this older person is actually depressed. Like you said that sometimes they can mask it, I'm fine and all of that. So are there any other practical ways that we can identify that another person is depressed? And similar to that, could there be other, what do they call this in nursing or in medicine now? A similar condition that can be mistaken to be depression. I've forgotten the terminology now. you know what I mean? Something similar that we can look out for, amongst other people. Thank you.
All right. Thank you so much. Yeah, I think you're talking about the differentials when you're talking about maybe
Differential,
differential
yeah.
diagnosis and all that. Yeah. So the first question about how to diagnose depression. I mean, you don't just look at people's face and say, "Oh, this person is depressed," or you don't just jump into conclusion as well. That's where expertise also come in, because I think a short while I had a friend who had, an uncle and all that, and then they noticed there were some traces of, things that look not even depression now looks like Alzheimer's and dementia. So it was more like dementia. We weren't sure what type of dementia it was because he gets into arguments. He has become so irritable, and then he gets lost in thought and so many other things. But the challenge for them as at then was, how do we bring grandpa and all that to the mental health unit? Because that's why I say the cliche of in Africa setting, if you take someone to the mental health unit, the man can flare up and just throw every, tantrum. So do you mean I'm mad, or, all of that? So it takes a lot of patience. It takes a lot of um, making them to understand that the main aim of doing this is to support them. And that's why they must, at that point, seek for medical counsel. But of course we could see then when you're talking of how do we identify, just as I said, someone who is withdrawn from their usual way of life, some become physically unkempt. You could see someone who is not maybe taking the bath, who is not eating. They're not, some would go on maybe some undue fasting, so you say, and they're not taking the meal that they ought to take, and there's self-neglect. There's so many things. The house looks unkept, and then they could be locked up for days. Some will be in their room for days if no one, checked on them. So definitely those are fundamental signs we see. But how do we now help? How do we, if it's someone in an institute, it's easier because already the person is, in a home or in a care setting and all that. All they need is just invite experts to come have a look and have a word with them. But when it's in a community setting and a home setting, that's why it's difficult to be in isolation, because it's always easier, to get more depressed when they're in isolation. So helping individuals to come together, helping individuals to work in a social circle, help them a lot. So it may not be chronic, if it's just 2 weeks, it may not be chronic, it may just be a situational, depression as that, if it's just 2 weeks. And that's why we have the other one, which is mentioned as chronic. If it's 2 years, of course, it's even more like, we wouldn't call it permanent, but it's because there's nothing that cannot be reversed, like irreversible. But at that instance, we need expertise as well. We need, to because some would come as maybe just an isolated case. Some will be a factor of so many things, come together, like someone who is bereaved, who has osteoarthritis, who has cardiovascular problem, who has a dementia. That's a whole lot, for that individual. So I wouldn't see why the reason why such would not be depressed. So if you talk to tomorrow, it wouldn't solve the problem if we don't have medical intervention, like taking of medications, going for a physio, doing so many other vocational things. So we don't just say, oh, you are depressed and I'll solve it for you by sitting by your side. We need it to be established and diagnosed, so we'll know the appropriate measure of medications or therapy to give, to individuals. So that's very fundamental when it comes to caring or, solving or identifying with individuals who are depressed and then, getting them out of it. So it's a gradual process. It doesn't just happen overnight or get solved too overnight, but we need to take the initiative. But our approach matters. Thank you.
Thank you very much. I think there's hands raised up there. Tell me. Okay, there is Dr. Joel Faronbi's hand is up.
Yes, please.
With question or contribution. You're welcome, sir.
Yeah, thank
My
you
own
very
lecturer.
much.
My own lecturer.
Yeah, good evening. I'm glad to be part of this webinar, and
Thank you, sir.
I'm happy to be here this evening. And
Okay.
I want to commend this group, the Age Well, that the good work that you have been doing. I want to commend your effort. I want to commend your good work that have been, all the good things that have been putting in place to ensure that we have a healthy aging population in Africa, especially in Nigeria. Thank you very much for all this good work that you have been doing. I'm very happy that this work is continuing. Thank you very much. And I also want to say that it's a privilege for you to champion this particular cause, that in Africa and especially in Nigeria, that you have a very little focus for the care of older adults, and you don't have many organizations, many individuals that can champion this. Many people, they want to go to where they can make name or where they can make money, and that's why you see that in Africa or in Nigeria, the care of older adults is I mean, most of the time you can say that it is in neglect, or people pay little attention to it. So for an organization like this to shadow this responsibility is a very good one, and I pray that God will continue to strengthen you. God will continue to enlarge and expand this organization. So my little contribution to this discussion this evening is to looking at it from the point of social isolation, loneliness, and depression. And the three of them, they are interrelated. And often in the academic cycle, we often ask which one is the precursor, which one starts first. And if you continue to dig deep and deep, you find out that you continue to see that they continue to interrelate. Somebody who is depressed become isolated and become lonely. The one who is isolated will also get into loneliness and become depressed. So we now look at it. Where does it start from? So, and that's something that the academic cycle they continue to unravel, and they will continue to do that more and more. And my little contribution to that is that one of the approaches and one of the ways by which you can tackle it is by looking at how can we address isolation among older adults, how can we address loneliness, and through that one we can cope depression. And one of the gifts that God has given unto us, especially in Africa, is the gift of men. And also we have a society, we have a religious group, religious a place of worship. So, but most time at old age, these older adults, they long for things like that. They long to be in the midst of their friends, in the midst of their acquaintances. But because of one little thing or the other, which have been mentioned earlier, and also I want to also celebrate my wife for the good work that she has done, and thank you also for inviting her. And I want to thank her for the good for the job that for the good justice that she has done to the topic this evening. Thank you on both sides. So, and then she has talked about many things that could be responsible for diminishing in association, diminishing connection among the older adults. So one of the ways I try to provide solution to it is that is there a way by which you can promote interaction among these people? And you look at it that in developed countries, they try to make they try to make provisions for older adults, for old people to be able to come together. Those that are in nursing home, those that are not in nursing home, they make provision for them to come together, which we don't have. As I said earlier, some of these old people, they long to be in the place of worship where they used to be before. They long to attend program and the societal events that they used to attend before, but because of limitations in mobility and all those things, they couldn't go. So I'm looking at it in a way that is there any way by which you can promote mobility? Is there any way by which you can promote connection? Is there any way by which you can promote interconnectivity among them, either physically or through social media? So if you can do this, I believe it's going to promote interaction, it's going to reduce loneliness, and it's going to put an end to some predisposing factors to depression among older adults. So if there's a way we can tackle it from that particular angle, I believe it will go a long way. Thank you.
Absolutely. Thank you so much, sir. I think you just nailed the how do they call it now? On the edge. You just hit the nail on the head, so to say. Very vital information there. And just speaking on that, I just need to acknowledge properly, Dr. Faronbi. Is it Professor Faronbi that I start calling you Professor Faronbi, who happens to be my lecturer, in OAU, Obafemi Awolowo University. It's such a great privilege to have you here, sir. And I'm not surprised by your wife as well. That was wonderful. Thank you, sir. Thank you for the support. So I think where I want to start from, and like you made valid points about social isolation, loneliness, and depression, which is one of the, like I mentioned, a personal story for myself as well. So it's one thing that we are also focused on in Age Well. So I'll just talk briefly about how Age Well Care Link can help, what we plan or what we have in place to help manage depression in older adults, not just in Africa, but anywhere. So first, our platform is integrated care, like we call it, is the first. We are happy to share that Age Well Care Link is the first in Nigeria, in Africa, the first integrated care platform, digitally enabled care platform for older people. And what we aim to do first in terms of managing depression is early detection and monitoring. So through our integrated care platform, both the caregivers and their families, they can track changes in mood and behavior and health. So once the app is launched, of course, you will be the first to know. That's why we are sharing this information and hosting all these events in order to create more awareness as well. And please, there's a link there in the chat for our social media, and it's just to follow us so you can be updated. So once any caregiver or family or an older person comes to our platform, they have access to a free care need assessment. So we have used the combination of comprehensive geriatric assessment tool, which is a globally, verified tool, as well as the Interrel. So we used both to develop a care need assessment. So it's a free one, so everybody gets to, complete it. And with that, we then generate a personalized care plan. So the care need assessment, once completed, will help us to identify, that's the early detection. So if there are deviation from the normal health, of that other person, that will be picked up and a care plan will be generated. So through our caregivers that will be onboarded on the app, they provide regular check-ins, and these will also help to identify any early signs of depression before it becomes severe. The other thing is access to trusted caregivers. So we know that, just like you mentioned, loneliness sometimes, social isolation. We also think that we need experts. So where the experts are not available locally, our older persons on our platform will be connected with trained, compassionate caregivers, as well as international experts that could help them, that could support them or help them manage their condition. So our care is not just about medical needs. As a matter of fact, we are more preventative focused because we know Age Well focus is not just on emotional, mental, or social well-being. So we used an integrated care approach, including mental wellness strategies. In terms of social connection, and I think, like Dr. Faronbi said, very important. So we have a plan, apart from being a virtual platform, to also, in the nearest future, which we hope will be very soon, to launch our physical integrated care hub. And this is where other people can come to engage through community activities, meaningful interactions, and we'll have caregivers as well to monitor them and to support them in that space, like a daycare service, but really integrated care. So this is one of our big visions, and we hope that we can start one state to the other and one country to the other in Africa and at large. So yeah, some of the things I want to share. So in short, Age-Well Caring, we don't just provide care, we build a circle of support around older persons and helping them to live with dignity, connection, and hope. And in this age of, digital age, almost everyone has a phone now. So even if it's not an Android phone, we have built a system whereby an older person can get even an SMS on something that will cheer them up, that will make their day better, like a message. And for those who have WhatsApp, so we have an Age-Well Caring community where older people can also be part of and get up-to-date information about their well-being. So we do have so many things in stock for our older person. Okay, Kemi, I hope I still have time. I can talk about Age-Well forever because that's what I live on, breathe in, and know everything. I think just to close up, if we don't have any other contribution, I just wanted to share a bit about some news, good news actually. And everyone that's attended our webinar will be the first to hear some of the exciting things that are coming in Age-Well Caring. While we are waiting for the official launch of our app, we're just going through some testing at the moment, piloting it and making sure that all the features are okay. We will be having our official launch in Nigeria. Drum rolls. Okay, our official launch in Nigeria come November. I hope somebody will be excited. Yeah, so fingers crossed. We are looking forward to the official launch, and also what we term the Caring Forward Conference. We call it Caring Forward because this is now the time that we also have to care for our older person. And as we do that, we are also building a legacy, a system whereby we also, when we grow old, we will be looked after. So we'll share more information about the conference. Just please keep an eye. And one of the things that we are looking forward to do this conference is to bring together policy leaders, government agencies, healthcare professionals, community leaders, families, and older persons, so that we can have a robust discussion on how we can support the older persons, bridging the gap in the elder care gap across families and communities. So I don't want to spill all the bean here now, so please keep an eye, and I hope that you can join us on the day if you're in Nigeria, if you're in Ondo State, and it's going to be in Akure. I need to tell that it's going to be in Akure because I'm from Ondo State. I'm not biased anyways, but it's going to be in Akure. So please keep an eye for that. We have a waiting list for healthcare professionals. I don't know, Kemi, can you share that on the link? So for healthcare professionals who want to onboard, you can join us in Age-Well Caring to support our older people. It doesn't matter if you're in Nigeria or not. Just sign up so that you can also help provide your own service. Either you're a nurse, a doctor, a physiotherapist, a dietitian, a mental health practitioner, even if you're a caregiver for our older persons. And we have that waiting list, so you'll be the first to be on board once the app is launched. And what's the other information, Kemi, that I wanted to share apart from the waiting lists?
The volunteer link.
Yeah, so we are also calling for volunteers, especially towards the launch in November. So you can volunteer in different ways. So the link will also be there for you to join. So thank you once again for joining us today. We're looking forward to a better world for our older persons. Thank you.
Thank you so much, Ma. Thank you. And thank you to Dr. Grace for your great insights. We're so grateful. Thank you to Professor Joel also. Sorry for my voice. Thank you to Dr. Joel also for your contribution. We're grateful. And to our lovely hosts leading us in age well, thank you, Professor Olainka Remo. And to everybody that joined, thank you so much for joining. So we have all our socials on the chat box. Please do well to follow us on social media and also on our community on WhatsApp so you could get regular updates and more about the launch coming up soon. Like you have heard, our launch is coming up in November. So we're hoping that everybody here will be part of it. And we're grateful for your participation here on the webinar. Thank you so much. A follow-up link will be sent to your emails where we get feedback. A form will be sent for feedback. Please do well to fill the form so we'll know how we do and to encourage us for further webinars. Thank you so much once again, everybody. Thank you for joining, and thank you to our speaker once again, and thank you to our host. Somebody's hand is raised.
Okay.
Okay, so I can go on, please.
Dr. Jen, yeah.
I just remember something now that to join the program, it was mandated to register. That's a very good approach. But at the same time, I'm looking at it that that might have limited the number of attendees. So maybe if there's a way, I know that it is very important for you to keep a record of registrant, participant, to be able to trace them both legally and also for follow-up. But at the same time, because I know that for our people, especially where we come from, that some people, that 30 seconds of registering may be so much on them that they just want to click the button of the program and launch onto the program immediately. Probably that will encourage maybe a larger participant or participation, a larger audience, and then maybe after they might have been in the program, you can now emphasize registration. So maybe you can look at that if it is possible. Thank you.
Thank you so much, sir. Thank you. That's taken on board. Thank you. Please, I know we said we will send some link for evaluation, but even if you can just give us some of the feedback, if you want to type it just in the chat box there, please feel free to do that as we round up. Thank you.
Thank you so much again, once again. And I hope that these words that we have learned will go out there and be patient with our older ones. Let us be doers of these words, not just hearers, please. So let us try to, imbibe these words in our day-to-day activities when we're, handling or attending to our older loved ones. So thank you so much, everybody. This webinar is coming to an end right now. We're so grateful. We'll see you at future webinars. Thank you so much.
All right.
Bye,
Thank
everyone.
you. Bye. Thanks for having me. Thanks for the invite. Thank you so much. Right. Bye. Thank you,
Thank
Professor
you.
Lainka.
Bye.
Thank you.
Thank you. Thank you, my dear sister. Bless you. Bye.
Bye.